Hi everyone and welcome to Webinar Wednesday. I'm your host Jessica King and I just wanted to quickly say thank you for joining us today. As you probably know, February is Heart Health Month. Did you know that cardiovascular disease is one of the leading causes of deaths per year? The good news is you can start taking care of your heart right now. Today's speaker, internal medicine physician Dr. Steffanie Campell, will go over some tips to make you and your heart healthy and happy. Here's a little more info on today's speaker. Dr. Campbell is board certified by the American Board of Internal Medicine. Her clinical interests include preventative care, individualized care plans, and women's health. She practices at the Pearland Clinic location. And a little fun fact about Dr. Campbell, the best piece of advice she has ever received is live for today. Don't forget, we'll be taking any questions you have at the end of the webinar. If a question happens to pop up, just type it into your question box and we will do our best to address it after Dr. Campbell's presentation. And now I'll turn it over to you, Dr. Campbell.
Thank you, Jessica. Hello, everybody. We're going to talk, like Jessica said, about heart health today. I will take questions at the end, but the good place to start is at the beginning. So first of all, what does your heart look like? And here's a picture, as you can see. It's a lot more complicated than we sometimes give off. So there are 4 chambers, there's a lot of valves, and the blood flows in very specific ways into the right side of the heart and out the left side of the heart. And it really isn't on the left side where we all tend to put our hand when we pledge the allegiance. It's kind of more in the middle of the chest. However, the tip of the heart does drift over to the left, and so this is why we tend to feel more pain here, or our heart beating if we lay down and rest quietly. You'll tend to feel it more on the left side. The other reason we tend to have the heart described on the left side is because the left chamber of the heart, which is responsible for pumping the blood to the body, is the largest part of the heart, and so that is the quote-unquote most important part of the heart. We always measure a heart rate when people come in for their office visits, and sometimes it's a little high or a little low, but so everyone always wants to know, well, what's normal? Well, a normal heart rate is usually around 70 to 80, depending on if you're a man or a woman, and we'll get into that a little bit later. But the node that causes the heart beat is called the sinus node, and that's at the top of the heart. So it goes from the top all the way down to the bottom. And your heart is actually very ingenious and has other areas that can pick up beating if for some reason the sinus node is not working well. As you know or experience, I'm sure, if you're more active or if you're nervous, your heart rate will increase. And this is normal. That's a normal, good response. If it stays consistently elevated, then it's something that we should probably talk about. How does a man and a woman's heart differ? Well, in lots of ways, especially when it comes to talking about heart attacks and how women feel it versus how men feel it, or where women get disease versus where men get disease. And in general, a man's heart weighs 10 ounces, whereas a woman's heart weighs 8 ounces, which kind of makes sense. Men tend to be a little bit bigger in size than women, and so their hearts also tend to be bigger. So do their lungs. The average heart rate of a man is 70. And like I said, that of a woman is about 78. So just as the smaller the heart is, more it has to beat to move more blood. Just like a hummingbird's heart rate is extremely fast, over 100, 150 at rest. That's because it's a very small heart and it has to move blood, and so it has to move it more often. So did you know that cardiovascular disease is the leading global cause of death? This is amazing. One in 4 women suffer from heart disease versus 1 in 30 from breast cancer. And so women always, we always think about breast cancer being the big killer of women. Well, it's actually heart disease. And for men, heart disease is also the leading cause of death. So now that we know that it's important and what it looks like, how can we make sure that it stays healthy? Well, exercise, as we all know. And why is that? Well, the heart is a muscle. And so just like exercising the other muscles in your body, make them more efficient, make them more tone, help them to metabolize things better, the same for your heart. And so if you're doing exercise, you're making your heart more efficient. Eating a healthy diet. And this is important for a lot of reasons, but anything that's high in fat or cholesterol, those are things that are going to harden the arteries and make it very difficult for the blood flow to get to the heart, which can then lead to a heart attack. Absolutely no smoking. Smoking increases lots of things, not just heart disease, but again, all of the toxins that are included in cigarettes and cigarette smoke are very toxic to the heart and to the arteries and can lead to heart disease, strokes, and lots of problems. The other thing is to visit with your doctor, your healthcare provider, and talk with them. What are my risk factors? Sometimes family history comes into play. Sometimes we can do lab tests looking for inflammatory markers or diabetes or other things that we know are bad for the heart. So what should your exercise plan be? It doesn't mean that you have to go out and try to do Orange Theory at 5 a.m. every morning, although if you can do that, kudos to you. I wish I could. Any sort of exercise where you increase your heart rate and you make your heart work a little bit harder is going to be good because that's training the heart. And so walking just for 20 minutes a day can be excellent. This may not help you lose weight, but it will definitely increase your cardiovascular benefit. And so you want to, again, it's a muscle. You want to train your heart like you would any other muscle. The best exercises for the heart are the things that we call cardio, right? So an aerobic exercise, biking, jogging, walking, getting your heart rate up, whatever it takes. So if you're doing an exercise and you're still able to talk to me, you're probably not working your heart. If you're doing an exercise and you're breathing hard and you can only get 1 or 2 words out at a time, that's good. You've got your heart rate up, you're really working that muscle. What are the best food choices? So, of course, fresh fruits and vegetables, we all know that. What's really difficult to control are the carbohydrates and the sugars, the processed foods, the saturated fats. And so these are always hidden. You always want to take a look at the labels on the food choices that you're making because sometimes it may say low in fat, but that just means it's lower in fat than the actual heavy fat. So for instance, light ranch still has quite a few carbohydrates, saturated fats in it. It just, by the labeling light, means it has 50% less than the actual real ranch. It doesn't mean that it's actually light in fat or calories. Salt. Salt is big on high blood pressure, for retaining water. So you really have to try to decrease your salt. And this isn't just adding salt to foods. Salt is hidden in everything. Anything out of a can, a box, a jar, anything you get out of a driveway window, anything you get from a restaurant is going to be high in salt. And so you really have to try to limit these and avoid these. I always say 2,000 milligrams or 2 grams of salt per day is about your goal. And so if you look at the back of a Diet Coke, it has already about 240 milligrams of salt. So you're getting it in places that you don't realize. The American Heart Association, listed down here, www.heart.org, has lots of great heart healthy recipes that you guys can try to look at and see if you can find something you find tasty, but with less salt. Like I said before, no smoking. Smoking by itself, even if you eat healthy and exercise, although I don't know many smokers that run marathons, it's not impossible, but if you eat healthy and exercise but you smoke, you negate anything that you're doing to try and keep your body healthy. Also, secondhand smoke has been linked to heart disease, and third-hand smoke has started to come into the research in the news these days. And third-hand smoke is when somebody goes outside and smokes, gets them all over their clothes, and then comes inside and sits next to you and you breathe that in. You're still getting some toxins. It's never, ever too late to quit. as soon as you quit, your body starts on the healing process. And so you can reverse some of the damaging effects that you've done over time, not only to your lungs, but to your heart and to your skin and your other organs. And so if you need help quitting, make sure you ask your healthcare provider for some options, some things we can do to help you. And like I said, come see your doctor, your healthcare provider, and make sure you have a good relationship. You want to be honest with them. Tell them the things that you're doing or the things that you're having problems with, such as I'm a stress eater, so I can't get away from my potato chips, or I'm a closet smoker. I don't tell anybody I smoke, but I do at home. Make sure you are honest with your doctor so that they can help you with those risk factors. You want to get regular checkups. There are certain things that we need to check on a yearly basis. There are certain things we need to check every other year, every couple years, depending on what your risk factors are and what diseases you may already have. And then if we find something, we can help talk about how to either prevent further progression or reverse the process, or if there's medicines that you need to take to help keep your heart healthy at the time. The other thing we can talk with you about is getting a referral to a dietitian. Although here at Kelsey, you do not need a specific referral. You can just call and make an appointment with any of our dietitians, and they can help you find low salt diets, low saturated fats, low carbohydrates, or all three if you need all three. So, these are all the obvious causes of heart disease. We know that people that eat poorly and don't exercise and smoke and are in the obesity range have a higher risk from heart disease. But there are some other surprising things that can cause heart disease. One of them I think you probably could all guess, and that's stress. But the other things are cold weather, emotions, and infection. We'll talk about how that happens. So cold weather actually causes constriction in the blood vessels. So it can put you at risk for having a heart attack or a cardiac episode. So this is going to be an abrupt change or prolonged exposure to cold. And so you want to make sure that you're dressing appropriately. You're not exposing yourself to cold water. So nobody go out and become a polar bear member unless you know that you have a good, healthy heart and you can handle it. My dad used to turn the cold water on in the shower to scare us when we were kids, and please don't do that. Not that I would think that your 7-year-old would have a heart attack, but don't do it to your husband, I guess. Emotions, they can increase your risk if you already have that protoplasm for developing heart disease. So if you're already have diabetes and smoking and you've already got some blockages in your arteries, and then you raise your heart rate all of a sudden because you get angry or you get anxious or you're scared, your body may not be able to compensate for that, and you may end up having a heart attack. And this brings me to a good point. When we talk about heart attacks, sometimes I don't think we all understand exactly what that means. And so a heart attack can happen in a multitude of different ways. There's actually 5 different types of heart attacks. The one that everybody is familiar with is whenever a blood vessel is blocked by a plaque or a clot, okay? The other kind is whenever you have an area of the heart that isn't getting good blood flow for some reason and that muscle dies. So heart attack in itself just means the muscle dies. It can happen in either of those 2 ways. The other 3 are more medically related and not of concern right now for this lecture. So for instance, if your artery is narrow, it's like putting your thumb over the edge of a hose. And so then if you all of a sudden need more water and it can't get through, then that area that you're supposed to be feeding with that water, or blood in this case, is going to die. And so that's why we say sometimes people get quote unquote heart attacks if they have rapid blood loss, or if they increase their heart rate too fast, or if they're infected and they're not getting enough blood pressure or blood flow. Speaking of infection, Inflammation causes a lot of bad things to happen in the body, one of them being plaques to rupture or plaques to form or blood clots to form, which can lead to heart attacks. This is why some people nowadays are measuring inflammatory markers with lab works to see if you are at risk. We call this the CRP, or the C-reactive protein. If this is elevated, then we do think that your risk for heart disease is elevated, because it tells us that maybe there's something inflammatory happening in the body. And stress. We all know stress, just like emotions, can increase your risk for a lot of things. Not only does it increase the heart rate and the blood pressure, but it can also increase the inflammation in your body. And so all of these other things that we've talked about are kind of confounded or brought to light with stress. And oftentimes I think people think when I tell them you want to eliminate stress from your life, or decrease, it's impossible to eliminate stress, but decrease the stress in your life or try to find a way to cope with it better, they think that I'm just kind of finding an out. I don't know how to say why they feel this way, and so I say, it's just stress. But we actually do know that stress can hurt the body. There is a diagnosis called Takasabu's, or broken heart syndrome. And it's when people undergo pretty profound stress. So the loss of a loved one or a trauma of some sort, and they bathe the heart in epinephrine and norepinephrine, and the heart will actually dilate and fail. This is kind of the working theory behind, the little old people that are in their 80s and been married 50 to 60 some years, and one dies and then shortly later the other one dies. They think maybe this is what happens. And so we do have actual evidence that stress can be toxic for the heart. So that kind of wraps everything up to give you a general overview of how your heart works, where it is, and what we can do to maintain heart healthiness. I'll go ahead and open it up for questions.
I want to start us off. Is there a test that we can take of some kind to kind of see where our heart is currently and the stage that it's in?
Oh, absolutely. So there's lots of ways to determine this. One way is talking with your healthcare provider. So I have I kind of questions that I ask people. If you're able to do these certain activities or certain things, then it tells me they have good heart health if they're not getting symptoms. And believe it or not, one of them is sex. If you can get through that and you don't have any chest pain or shortness of breath, you're actually achieving about 7 metabolic equivalents, which is pretty good.
Well, all right.
The other thing is lab tests, checking your cholesterol, checking for diabetes, checking your C-reactive protein, making sure it's not elevated.
Okay, and we can just come to a Kelsey clinic and ask for these tests? Or?
Absolutely.
Okay.
Yep, anytime.
Awesome. That's good to know. We have another question here. For us office workers, how often should we get up from our desk and walk around?
Oh, I would recommend getting up at least every 2 hours. If you can get up and stretch every hour, that's good. And not only just for your heart, but for a lot of things. You don't want the blood to pool. You can be at risk for blood clots. But a lot of people complain about foot pain or leg pain or back pain. And a lot of that comes from just sitting in one position for a prolonged period of time. So if you can stretch and increase blood flow and keep everything limber, that's really good. Somebody asks, can a high heart rate be congenital? Absolutely. So there are some people that have a higher resting heart rate than other people. I always investigate this and make sure that there's not something else causing this that we haven't overturned yet. But some people just tend to run a little bit higher. And as long as you're not having any symptoms or any problems related to it, then it's not something I would treat or worry about. Okay, so then next one, how do alcoholic drinks affect the heart? Well, I can tell you this from personal experience. No, I'm kidding. I do like my wine. So alcohol is in large quantities is actually directly toxic to the heart. And so it can cause dilation and death of the muscle. And so anything over the recommended, which is 8 ounces of wine or 12 ounces of beer or 1.5 ounces of liquor, quote unquote, hard liquor daily, anything over that has the potential to actually damage the muscle in the heart. Someone's asking about if you start taking an aspirin from a physician's directive, you can never get off of it without any consequences. That's not true. It depends on why you started taking the aspirin in the first place. So sometimes we give aspirin preventatively if you meet certain criteria. And in that case, we're just trying to prevent something from happening. And so if you come off of it, maybe your risk goes up a little bit, but it doesn't mean something's going to happen. After being on aspirin, your platelets are dysfunctional for 7 days. So it takes about 7 days for the effects of aspirin to wear off. But there's no other rebound effect or anything that I can think of with the aspirin.
Can I add on to the alcohol question? Is there a certain amount that a man versus a woman should be drinking per day or per week? Is there any guidelines?
They say men are allowed to have more if you want to be a purist and get into technically, but just for easy remembering, I always tell people 8 ounces of wine, 12 ounces of beer, or 1.5 ounces of hard liquor per day.
Okay.
Is the recommendation.
Okay.
And a normal glass of wine is 8 ounces. They sometimes give you the big pour.
Yes.
And so that would qualify as 2, obviously. But
okay.
Yeah, a lot of the Mediterranean diets actually say 8 ounces of red wine with your dinner. Yeah, which is why I like the Mediterranean diet. Why do runners have lower heart rates? Great question. And this actually goes into the exercise part. So it's all about becoming more efficient, right? So we make efficient cars, we make efficient computers, we do all this. And so runners, and it's not just runners, swimmers, bikers, anybody that has cardiovascular training lowers their heart rate. And the reason is because the body makes adjustments. As you work the heart and work the body, you start to make adjustments for that. So your heart becomes more efficient at pumping. It pumps more blood with each pump. It lowers the blood pressure, so there's less resistance when you pump. So then it, again, can pump more. Your body becomes more efficient at taking the oxygen out of the blood, so it kind of shifts the hemoglobin a little bit, so it releases the oxygen easier into the tissues. And so essentially, you just don't have to work as hard. And so when they're at rest, their 40 beats per minute, like I think Lance Armstrong's resting heart rate is in the 40s somewhere, is equivocal to somebody that doesn't exercise about 80 or 90 because their body has just become so efficient. So somebody says they're in their late 50s, they take a blood pressure medicine and they have had a high cholesterol. They don't want to take the cholesterol medicine. Understandably, it has been getting a lot of bad press lately. And is there a way to bring this down with diet? Absolutely. So low cholesterol diets, again, these are the saturated fats. So the unsaturated fats, the one from vegetable oil, nuts, those aren't necessarily the bad ones. It's the saturated fats, fried foods, processed foods, anything that tastes good, basically. And then fiber. High fiber diets can really lower cholesterol. The other thing that you do, cholesterol is not just one number. It's good cholesterol and bad cholesterol. So if you have an elevated good cholesterol, it kind of negates some of the effects of the bad cholesterol. And you can raise your good cholesterol with exercise. And some studies have shown with an 8-ounce glass of red wine nightly also. And so if your cholesterol is high, but it's all or mostly good cholesterol, then you don't need to necessarily worry about it as much. The other thing is you should always ask your doctor if you really need the medication. The American Heart Association puts out guidelines. If you're above a 5% risk in 10 years of having a cardiovascular event, they suggest that you go on medication. But if your risk is less than that, they actually don't suggest you go on medicine because the risk of side effects doesn't outweigh the benefit. Somebody wants to know what normal blood pressure measurements are. So perfect is 120/70, right? So that's the quote unquote goal. Anything over that and up to 140/80 is considered pre-hypertension, but doesn't necessarily require medication. And anything over 140/80, we usually recommend starting medicine if it's consistent. The other thing to remember is blood pressure is dynamic, so it goes up and down depending on what you ate and how you're feeling and whether or not you're exercising. And so it's more if it stays consistently in an elevated area that we worry. If it's lower, some people ask me if it's dangerous to have low blood pressure. If you're standing and you're talking to me, then your blood pressure is okay. If you're passed out on the floor and you have low blood pressure, it's not okay. So there's really no low level that I would worry about as long as you're perfusing your brain. Let's see. Someone asked a question about her daughter who's been called morbidly obese, and that's important to keep in mind that when we say this, it's just based off of a BMI number. So if your BMI is above a certain level, then we say that you're obese. When she's having a hard time doing anything due to some unfortunate, I'm sorry. And they want to know if this deep depression and stress can cause a heart attack. It definitely increases her risk. If she already has underlying risk, given if she has prediabetes or diabetes or cholesterol or high blood pressure or any of those problems and is now going through a very difficult time, it certainly increases her risk of a heart attack. It's not uncommon, actually, that people are depressed, which leads to health problems. You know, they come to see the doctor and we say, why aren't you taking your medicine? Why are you not exercising? Why are you not eating right? You know you should do all of these things. But what we fail to ask sometimes is why they don't want to or why they can't. And so oftentimes if we help people and we treat their depression, then everything else falls into place. And they actually start to take better care of themselves because they feel better and they now have the energy and the motivation to do that. So maybe encouraging her to come talk to her doctor or someone about how to help her cope better with the things that are happening in her life now will actually help her make the changes to get her heart back into a healthy condition. How bad is it to have 2 glasses of wine? I guess this depends on how often. The guidelines, say one glass of wine. And I tend to have the philosophy that you do everything in life with a risk versus a benefit, correct? So the risk of having 2 glasses of wine, you may increase your risk of liver disease, of nutritional problems, and of heart toxicity. How much? I don't know. It probably is of a minimal percent, but we don't have people that are willing to do those studies. Unfortunately, we don't say, okay, you drink 1 and you drink 10 and we'll see who dies first. The government won't approve those. So I think if you're willing to take that risk and you enjoy the benefit you get from that, as long as you're talking with your healthcare provider and you're doing everything else to maintain your healthiness, then I think that's your choice. Ischemic transient dilation, slightly elevated. I'm not sure if I understand the exact question with this. So if this person would send me a message offline or call, then we can talk about it and I can help you with that. The symptoms of a heart attack. Great question. I don't know. Men are the ones that get the classic presentation, right? Where you feel like there's an elephant sitting on your chest and they can't breathe and it radiates to the left side of the jaw and down the left arm, and they feel nauseated and they break out in a sweat and they feel dizzy and tired. Those are the quote unquote perfect heart attack symptoms. Women in general tend to present differently. And I don't know if it's because our hearts tend to be different and our heart disease tends to be different, or if we are in tune with our bodies because we go through a lot more than men do on a regular basis. We have menstrual cycles, we have babies, we have, we really have to deal a lot with our bodies. And so women, sometimes it's just fatigue. Sometimes it's indigestion type pain. Sometimes it's sharp pain and pressure. If there's anything that is causing discomfort or that you're worried about or isn't going away, is coming during exercise, waking you up at night, it needs to be evaluated. So I would go to the doctor with those questions. Absolutely go to the emergency room if you have any of the other things I talked about. Pressure, difficulty breathing, breaking out in a sweat, feeling like you're going to pass out. You need to be evaluated right away. If you have questions,
I'll give her your info.
What's that?
I'll give her your info.
Oh, okay. We'll give you my information. So,
or vice versa.
I think that is actually all the time for questions that we have. I want to say a very big thank you to you, Dr. Campbell, for doing such a great job today.
Thank you.
Yes, you did wonderful, and we hope the information was helpful to all of you. This concludes our webinar. Be sure to join us next month for our webinar, Eat Good, Look Good, Feel Good, 10 Healthy Eating Habits for the month of March, featuring our registered dietitian, Chris Nixon, which is going to be on March 2nd. And don't forget to follow us on social media and join in on the conversation. And that's it. Thanks again for tuning in, and we'll talk to y'all next month.